This is a recurrent tuberculosis case. Before COVID time, she came to us. Rashmita Khedekar, her name is 39 years old, female, living in Mandgaon. What is the TB? The TB is a chronic infection disease caused by Mycobacterium tuberculosis. Recurrent TB occurs due to incomplete treatment of the medicines, allopathic medicine, drug resistance or suppressed immune response. Globally, it is very concerned, and anti-TB drugs they are given, and many of the patients are resistant to the anti-TB drug or DOTS area. These are the present complaints of the patient. When she came, she never told us we are suffering from the TB. Initially, she came from the fever. Later, when I asked regarding detail, then I know she was suffering with TB, and that was fear of TB. So I normally, as I take the case, I took detail, but she hid the symptom of TB. So she told me she had fever from 15-20 days, and fever was not going. It was coming in the evening and going. By symptom also I can diagnose what, but she has not tell openly what was the condition. In a fever, only at night time, chill and heat stage was there. In fever, frontal headache was there, and increased thirst. And she was thinking breathlessness over there or walking. I was thinking he might suffering from initial pneumonia symptom, or stage 1 pneumonia, stage 2 pneumonia. I asked also, please do the X-ray or blood test also, but she was not willingly. As she might know, the doctor can know, they can reject my treatment also. As many of the doctors in the area, they directly send such a patient to the government hospital. They do not check also. They get frightened also. The temperature was 100 degree. Her cough was thick greenish discharge. Sticky expectoration with a difficult to take out. Cough was deep and continuous as if she started coughing. She was emaciating day by day, and disease condition was increasing. Complete loss of appetite, no loss of appetite, complete, since 15, no taste at least 15 days, and weakness in body and cramps. She was in dehydration, many allopathic medicines were given, IV fluids were also given for her in his Mandgaon area. She went to the nearby doctor, he took the medications, and again they give IV anti-fluids, IV antibiotics on OPD basis, but there was no change. So his father brought her to our place. He told, come to the doctor, we will take homeopathy treatment, we will see what is the reason. Then her father told me, next visit, he is suffering from last tuberculosis from 2 years. Last 6 months he is on anti-TB drug. In spite of that also, his health is not going better. And this is the second time she is taking the anti-TB drug. First, again failure, second failure. I told us to do the investigation first. We will see what is the results. After doing investigation, I found HB was 10, ESR was very high, WBC 12,000, Vidal positive, AB sputum test was positive for acid-fast bacilli tuberculosis, and case X-ray upper and middle zone shows TB focus. Her weight BP was 100/70, pulse 70, pulse 100, saturation 93/95. Right side wheezing and crepes or wheezing crepe infection on inspiration, and 34 kg weight. This was the X-ray when she came to me. Right side whole the scarring is there, and all infective TB focus what happened. And trachea is also shifting slightly, trachea and middle part. This is the report, positive, AFB positive report, government hospital report. 7/12/2020. Weight was 34. And she was referred to the higher center for treatment. They refer the patient to the government hospital at district level, and from that they collect the medicine and come to the nearest PHC or near area. So on that basis, I gave the medicine China Earth. Anyone said in the Mathematical and book, whenever the fever comes or whenever the intermediate disease come, you start with China or China salt, China Earth or China sulfur, China arsenicum. So I gave him China earth on that theory. The dose was 10 strokes, 50 drops in 100 ml water and 3 teaspoon 2 hourly for 3 days, and inform me after that, see what happens. In evening, the patient called, fever has reduced than before, weakness has still present, headache has reduced, cramps of the legs has reduced, cough is 2 plus, breathless is there on walking. So I continue the dose 4 hourly, continue till 3-4 days next. After taking that, on next 5 days, there was no fever, weakness was there, apparent little had increased, taste was coming slowly, thirst was better, no headache, cough was there, breathless was there, again continue same medicines. Till his fever state or till his what is the present state going, we have to continue the medicine. Otherwise, you can shift over to the antibiotic medicine also. Otherwise, you can continue with the same medicine also. So I continue the medicine till the present fever intermittent state was there of disease, it goes away. I showed the report now. This is the AB positive reports in Madgaon, and X-ray shows the area. And again in December, last December she came, mild weakness. Again she was having this symptom, the greenish cough was not gone. After giving the medicine, weakness, thirst, everything, general symptoms was covered. But the main symptoms of tuberculosis, breathlessness, walking, then greenish cough was already present. This was constantly not going symptom. So now there is a time to give the antibiotic medicines, okay, or whichever the medicine coming nearby. Chest, crepes of their lower and middle and lower regions. BP was normal, pulse was better, and I gave that time I was not having Kali iodine 0.1 potency. I gave him 0.2 potency. The dose were 10 strokes, 40 drops, 100 ml water, and 4 teaspoon BD, TDS for 10 days. Why I selected? I wrote in the search in the that greenish cough with a thick discharge, which are the medicines. In that medicine, lycopodium comes, lycopodium, then Kali iodine comes, Kali, all Kali group comes. And from that, the fibrosis is also there. Fibrosis state is also. So according to fibrosis, I searched the pathological way. Kali iodine cover those symptoms. After giving the Kali iodine, first follow, the appetite was much better. Her taste has come back in normal. No fever was there. General weak was better. No cramps, no headache. The cough started coming after, which was sticky and thick discharge, which was coming in the lungs now, which started coming out, which became loose and whitish color, and which was thrown out easily, which was difficult to throw out, and much cough it was coming, and from the chest, and breathless was breathing was also better than before, as because of cough she was having breathlessness, and discharge was more in the particular that area. Breathless was 50% better. So I continue 0.2 in the same dose. BD, okay. She came in January, no cough was there, no greenish cough, no discharge, nothing was there. Only mild cough it come. Breathless was only on exertion during working of the household extra activity. Appetite increase and weight increase by 1 kg. Respiration, no cramps, air entry was better. I continue with the 0.3 medicines, Kali iodine. 10 stroke, 40 drops, 100 ml water, 4 teaspoon BD. After that, I asked her to do sputum report. Let's see how is the sputum report. We have given the medicines from the November area. So the sputum report came negative in February. All the bacteria become negative. In March, again I told her, now you are taking the homeopathic medicine and continue in proper way, as you are in resistance phase. You have taken many anti-TB drug, then also it will not work. In future also, whenever you try, that will not, never ever work. Then you continue the treatment continually and get healed properly. Then she came after long time. She has no symptoms, so they stopped the treatment. She came in directly in March, 12 March. Mild dry cough was there, but no expectoration, no breathing was there, and she was looking better. You know how the TB patient look, very bones are sharp, faces are there. Now all her look was changed that time, and she was looking better. So I told him continue proper treatment and continue the proper way. I gave him the next potency, Kali iodine 0/4 potency, 10 stroke, 40 drops, 100 ml water, 4 teaspoon BD. And I told him to get tested again A, B 2 times. Let me see. Again, we should know, na. Sometime it can become negative. Again, we will check it. And I told him to do Mandgaon Civil Hospital X-ray. In next month, April, he came, all investigation, again the TB test become negative. Second time also I did a test, the test came negative, weight was increased by 2 kg. X-ray film was not given that time. She took out the X-ray, but they never gave X-ray film that time. So I told her to do X-ray outside and bring it to me, let me see. They only given the paper, something I do not believe in the paper report. No cough was better that time, no breathlessness, only mild exertion and breathless was the mild exertion. Why? The fibrosis was started already because of long-term TB disease. So a mild exertion was there, and I requested him to give the film and bring it from private hospital. I continue the same potency in 0/4 potency. These are the X-ray. They showed the last consolidation was there of the right lung, upper lung, but that was better than before. I will show the X-ray images also. In April he brought the new X-ray. That also month gone like that only. No cough was there. His medicine was finished also. They came that time. No cough, no breathlessness, appetite increase. Weight increased by 4 kg in last 3 months. And he was saying he was 100% better and had no complaint since December 2020. 4 months happens. After 4 months, this is the X-ray. Whole patch, whole fibrosis got recover. You know? The patient name is already here. Rashmita Khedekar. Date is there. And again, I told us to take antisuric medicine treatment. I have not given the antisuric medicine. This is only osuric medicine. But then also she left the treatment.
You would have completed with
Completed sulfur. Till last. And this bottle I used to do initially. This was a dropper bottle. 100 ml dropper bottle. This is the dose. Kali iodine last date is there, and all previous dates are written on these bottles.
The choice of China as good chinium or C2. Why not chinium sulfur, chinium?
We can give also. In China, when I read the chest symptom, the China earth is also covering the tuberculosis symptoms. Many symptoms are there. In China earth also. When I read the before breaking the medicine, no, it can cover those symptoms. Which was the initial primary phase of tuberculosis, it had covered. But greenish cough was not going. Because of greenish cough, I could have given this also. And other medicine will come lycopodium. Other medicine, if you give them tuberculosis, lycopodium or Kali